Welcome, Phil. Dr. Phil Parker, congratulations, you are a finalist in the healthcare category of the 2022 NLP Awards. I'm very privileged. We don't get to choose the finalists, but I do get to see the nominations, and I have your nomination here. It's so impressive, Phil. Reading just some of these things, that you've worked with the NHS and healthcare professionals globally, looking at ways to support them in the important work that they do, find solutions for their patients, and increase recognition and professionalism for NLP through published research. That in itself is incredible. So can you tell us a little bit more about that, and also more specifically the work that you've been doing since the pandemic, because I believe that you've been doing some very specific work relating to COVID as well.
Yeah, so the first bit is that you talked about is about working with healthcare professionals, and we work a lot across the world, different hospitals, different teaching institutions, clinicians, helping them to take bits of NLP skills and the other stuff that I do around the lightning process into clinical practice, because we know that just the way, things have moved a long way from, it doesn't really matter what you say to, we've got to have a good bedside manner. But of course, there's a whole another piece that we know, which is even the words that you use. So if, for instance, somebody says, I've got a phobia of needles, and they go, which is what they often do, they go, don't worry, it's not a big needle. It's not going to really hurt when I jab it into your arm, because they've been told that if you settle the patient by explaining it, that it will make things better. And we know that, of course, as soon as you say all that, the neurology of fear is being true. And there's not enough awareness of this. Another classic thing is scales. When they measure scales of like pain, for instance, they'll say, so you've got patients with pain, and you say, tell us about your pain. On a scale where 10 is the worst pain imaginable and 0 is no pain. And again, neurologically, it is kind of not great for the patients to be triggered in this way. So simple things like that can make such a difference that at the moment there's not enough awareness about. And so we do a lot of work around that. The other thing that she talked about is research, helping people to understand, because NLP has got quite a mixed reputation in health and in academia. People have focused bizarrely on some early studies that weren't very good, and there's a bit of a tendency to focus up on those and repeat those studies. So we've been doing some studies to say, well, look, here's some really good quality evidence written in words that you can understand, that's your language, that's been done with different universities, saying, look, these are the outcomes that we're getting, and publishing them in journals, and getting that conversation in a, because if NLP knows about anything, it's about communication. We haven't been great at communicating what we do,
and meeting people in their maps of the world.
Exactly. We've got to think, well, what is the complex equivalence for this makes sense? And one of the ways to do that is research, and a lot of it, and it takes a lot of time, but it's got to be done. You've got to start somewhere. So I've done lots of it and got lots of it published, and there's more coming. And in fact, as you talked about the COVID stuff, the work we've been doing specifically is on long COVID. So it looks like hopefully the pandemic is reducing, but the long COVID pandemic is massive, absolutely huge, and was the same, interestingly, in when it was the Spanish flu, that after the First World War, there was a huge amount of post-viral stuff. They reckon 50% of people, and that went globally, 50% of people never got back to work back then.
My goodness.
And the same with the SARS that happened in the 80s and 90s. So it's a phenomenon that's been around for a while. So we've been doing some early research on, do these interventions make a difference? And there's the case studies, which is like the very, very early research, which we're getting published at the moment, suggest, yes, they do make a difference. And we've been seeing quite a few people, certainly over 100 or so, already making massive changes with COVID. And unfortunately, at the moment with the NHS, they don't really have a great solution for it. Just like we hope it will get better. We're not quite sure what to do. So I think there's a real opportunity to help people, because if nobody knows what to do with them, they're just going to get stuck. And
absolutely.
So some really interesting stuff. I think we can contribute to people who are just like, I don't know what to do.
Which is fantastic and powerful. And as you say, you're working towards the research for that, which is going to take time and cost money. And in the meantime, you are still actually supporting these people who've got long COVID and making a difference to them. And presumably from their perspective, they're not actually that bothered about the research. They just want to feel better.
Yeah, absolutely. Yeah. And again, the stories are incredible. People going from, having a viral illness, COVID, not recovering properly, having to just lie down all the time for weeks or months at a time, and doing the lightning process, doing NLP, and then running marathons, going back to work, being completely well. And it's just amazing to see. And again, it speaks of both the power of this work and the extraordinariness of the human body, the mind brain body connection to shift physical illness and get back to real flourishing wellness.
Yeah, and if that's not empowering, what is, for goodness sake? So as I said, I'm very lucky to be able to read through all the nominations. And a couple, you were actually nominated by more than one person, which is lovely in itself. And just reading some of the testimonials that they've gathered. So it's difficult to put what I want to say into words. I'm so grateful for your work and your determination to find a solution to stuckness, which has led me getting a hugely improved life. And then somebody else has written, lightning process was a game changer for me with my long COVID fatigue. I mean, how do you feel? What does it mean to you to be nominated for an award, recognizing those things that people are saying?
It's really nice. It's really lovely because it's not been an easy journey. The area of health is very, very conservative. It's very, very cautious. Because health is precious. You don't want to apply something that isn't going to work.
Yeah.
And coming from the outside, we're not part of mostly the academic institution, coming up with new ideas, which is really good. Actually, it needs new ideas because when what you've got isn't working, you've got to think differently, and they're not great at thinking differently because they're the structure they work in. So coming from the outside is really important, but getting into that space is quite tricky. And hearing these kind of stories of, the genuine, real changes of people's lives, and then also having it being acknowledged, people being interested enough, it's a really important part of that process for us, because there are a lot of, long, hard nights of working and thinking and dealing with stuff. So to get some, positive feedback, not just from individuals, which is amazing, but also from organisations like NLP is a really lovely thing to have.
Oh, that's good. And I think the acknowledgement of getting the research published and everything like that is hugely important as well. And having doctors that recognise the difference that you're making is incredible. So if there was one thing that you wanted to tell us about what you do that makes a difference, what would that one thing be that makes a difference?
That's a good question. I think really remembering that we are much more influential than we might ever imagine. So Erickson talked about this, Milton Erickson, the very famous psychiatrist and hypnotherapist, and he said something like, we know that with hypnotherapy you can get rid of warts. This is quite well researched thing. And he said, if you can get rid of warts with hypnotherapy, it makes you wonder what else your brain can do, both positively and negative. What could we be building in a not a very useful way with our thoughts and the way our brain works? Yeah. And equally, what else could we make a difference to? And I think, again, that's really something that NLP has in spades. It really understands the importance of language, neurology, and influence, how we do have this incredible ability. And the question is, how do we mine that? How do we get in touch with that? So I think that whole idea that we are more influential than we could ever imagine.
Yes.
In both directions.
Yes, beautiful answer, thank you. So final question really is, where would you like to see NLP and specifically the work that you're doing in the future?
Well, one of our goals for the lightning process specifically, which is, this kind of application of NLP in health, is to have there be no barriers to it. So no barriers of access, that everybody can get hold of it. And to do that, it has to be delivered by the NHS or whatever the health service is, whichever country. And to do that, you need research. There are a lot of hoops to jump through to get there, and it's not easy. It's not particularly welcomed. New ideas, as I say, are not always welcomed. But we are getting there. There is a growing kind of recognition and knowledge about the value of the stuff that we've done. There's more to do to get to that point. But one of the things that's kind of sad at the moment is there are people out there whose lives are awful, and there are solutions that would absolutely transform those. And either they don't know about it, they've been misinformed about them, or they can't afford them. And those are all barriers that we would love to see broken down so that people have access to it. So that's the long game. That's what we want to do. Hopefully in my lifetime we'll achieve that, but it's a very slow movement to do that, because you have to engage with all these systems and organizations that are quite conservative, but we are getting there. And again, these kind of conversations where it's not just me chatting to someone, it's me talking to you, you're talking to the NLP community and everybody they're connected to, are the way these things change. I often think about people who've been dealing with similar things on a much bigger scale than we are. Like, if you look at Martin Luther King or Gandhi, how did they, and I'm not comparing me to them, I'm just, they were dealing with an impossible thing. Ours isn't impossible. Theirs was like, desegregation, or, recovering India for Indians. How did they do it? And one of the ways they did it was there became enough people talking about it. Enough people, because the single person can't do it. It's a group of people where this becomes a conversation that other people stand up for and talk about. And so that, again, is why having these conversations with you in the NLP community are so important, and the research community, because it spreads it from just me having a cup of tea, talking to a couple of people who already bought into it, to opening up to a larger conversation.
It's that ripple effect, isn't it? So thank you, Phil. It's been absolutely delightful to talk to you today. Good luck with the healthcare awards. The awards are being held live, virtually, but live, on the 13th, Friday the 13th of May. So and further details will follow for all of that, for everybody who's listening to this later. So thank you again, Phil. It's been an absolute pleasure to talk to you.
Lovely to speak to you, Karen.